So with this one, the sacrum is right on the bottom here.
Yeah.
So we're gonna scoop it underneath that L5 to get that joint to scoop underneath there. Relax this shoulder up right there. Perfect. There you go. So where are you feeling a lot of the pain right now today?
Right here, still right this
Right
side.
on that shoulder
Yeah.
here.
And in my low back too.
In the lower back? We're at in the lower back. Can you show me where?
Yeah. It's just over all this area here. Yeah, it's I think it's on the left hand side a lot more than
A little bit more on that left side.
On the left hand side.
Yeah, and I think that's what we talked about. It's more so on the left here and the left here as well. You know, and looking at your spine, it makes more sense looking at your x-rays now because on your sacrum, it's sticking out just a little bit more because you have what's called a spondylolisthesis on that L5 here. So when that joint shifts forward, that sacrum is going to pop out just a little bit more. And you can even tell just the way you're sitting this bone, it's just sticking out just a little bit more.
Yeah.
And so it's helpful to look at the x-rays because I can see the severity of what's going on here. So
the sticky bone out is what is the issue there?
So that's the spinous process of that L5 here.
Yeah.
And when that bone, the spondylolisthesis, or what we call a spondy, when that bone, it fractures basically from the body and the spinous process. And when those separate, you'll start to see that can stick out just a little bit here. Some presentations are a little bit different, but that's why we take a look at the x-rays each time you come in, because I want to know what's going on underneath the skin here. Because although this presentation it's sticking out, some people it actually might be the opposite. But you're going to notice when you sit though, it pops out just a little bit more and then it dips and then your spine kind of curves like that. And then that's where you're going to see, you know, in your x-rays you have a huge arch in that lower back here.
That's what it is.
Yeah, exactly. Now on your neck here, you know, on the x-rays you can see how your spine kind of curves to that left side. So it makes sense because you have some pressure.
Pressure on the left hand side.
Yeah, and so we're going to take a look at your neck. But a lot of times shoulder problems can come from the upper back, even like the lower part. So let's get you scanned. Let's see what's going on. And then we'll get you worked on, get you adjusted, okay?
Okay.
All right, the moment you've been waiting for. All right. So, and I'm trying to remember, because have you had any like falls or injuries on the lower back?
No, not really.
Nothing that you can recall?
No, I remember I just woke up one day and I just couldn't move.
A lot of patients, you know, they'll wake up one day and they're like, oh, my neck hurts, or they'll sneeze and their back goes out, you know. It's not the fact that you sneezed or the fact that you just woke up, but it's the fact that there's some of these issues have been going on for years. And all it takes is just one little move, and now it's like we have these issues coming about. You know, so it makes sense to looking at your x-rays here. Now, I'm going to lean you back here and see what's going on down below. Yeah, right there. Yeah, so that joint, it doesn't move very well. So that's your sacrum right there. Let's take a look. Yeah, that's not a problem. It's that sacrum, that's where it gets stuck. So ideally you should see that joint, it should move forward. But when it's stuck like that, you're like, ooh, that's not comfortable. So that's where we're going to focus on, is that tailbone right here in the sacrum. 1, 2, 3, 4. Here's 4, 5, 4, 3, 4, 5. Any pain or soreness on those? Not too bad.
Not too bad.
3, 4.
You know.
3, 4.
Yeah, that side on my left hand, this side of the shoulder, the muscle thing, I don't feel that much.
No, okay.
Yeah, that's what I think. That's something.
It's less sensitive. You feel less.
Yeah.
Yeah. So looking at it, so I'm looking for any edema. Right there is where we're gonna see it. So basically, you'll get what's called like an orange peel look, and that's where the skin it almost looks like like an orange peel. And that's where you're seeing right there is where the edema kind of sinks in there. 1, 2, 3, 4, 5. So that's T5. And then let's take a look at the neck here. 6, 7. Oh, there it goes already.
That's so easy.
Yeah.
For me.
5, 6, 7. Yeah, it looks like 7 doesn't want to move very well. Okay, so yeah, so we're going to start off with that C7 right underneath that straightened spine. So again, we're trying to push that forward to try to encourage your spine to move forward a little bit.
Okay.
5. Okay, and then we got that sacrum right underneath here. So let's get to work here. Chin down. There you go. Now I'm just going to bring your head over just a little bit here, and as you relax that shoulder, I'm just getting a bit of a push here. Okay. Relax in there. And actually, if you can just bring your chin up just a little bit. There you go. Good. Now we got a little bit of movement on that. I want to see if I get a little bit more on the right side. Okay. Just to get a little bit more of a deeper set there. Good. And relaxing that shoulder again. Chin up just a little bit. There's the rest of it. All right. Not bad. Okay. So with this one, the sacrum is right on the bottom here. So we're going to scoop it underneath that L5 to get that joint to scoop underneath there. There you go. All right. And as I roll you over, I won't let you fall, okay? There you go. That's all we need. And relax this shoulder up right there. Perfect. There you go. Little piece. One more. That's it. All right. So this one is going to be that T5 right here. So we're going to see that your spine goes right over to that right side. So we're going to close that down a little bit. 5. Good. Breathing in for me. Let it go. Dropping the shoulders. Nice job. All right. Have a seat right on over here. You're going to face that wall. Yep. We're going to rescan you now. Okay. Let's just see how that's looking here. Head down just a little bit. Right there's good. Good. All right, good. So that's starting to reduce already. Let's take a look at the mid-back. Good. Yeah, okay, now it's just got some heat waves.
What is that device for?
So it's the same thing that we did in the first appointment when we took a look at you. So we're measuring for inflammation. That's actually looking better, actually. Let's take a look at how that's moving down below. There you go. Good. Yeah, so it's still stuck a little bit, but I can tell you right now, there's a lot more movement already happening in there. Okay, good. All right. So that's where we're going to start off with, okay? So the sacrum here, remember how I told you how it's a little bit fuzziness in there?
Yeah.
So in that joint, the disc, what you're going to notice is those fibers, when they're damaged, they're going to have scar tissue. So in the beginning, we need to work on getting some of that adhesions or the scar tissue to loosen up a little bit so we can set that joint a little bit deeper. We got some movement on that joint, but because of the scar tissue, it's not going to fully release, okay? So as we get more and more movement in there, you're going to start to notice that there's going to get more of a release in that joint, and we're going to get that joint to set a little bit better. But right now, we got a little bit of movement in there, so we're going to see how that does. Next time you come in, we'll see if we need to get a little more pressure off of there by getting some more movement. Okay. But as time goes on, as that scar tissue loosens up, we'll start to get a better set on there too, okay? Okay. So let's see how that does. Okay. So we did your sacrum here. We also did your C7 underneath. Yeah. And then the last one we did was your T5 right in the center here, okay? So let's see how that does, and then next time you come in, you're going to let me know how you're feeling. Okay. But then after that, we're going to see what we're going to work on after. Okay? Okay. All right. That's good. Have a wonderful day. You too. That's going to be it for today. And then next time, we'll get more movement on that and see how things do. Okay?
Okay. Thank you very much.
All right. Have a wonderful day.
You too.
We'll see you next time. Bye.